The femoral, that's been studied. So Dr. Deneau, recently published a paper on pulsatility in the femoral vein, and it does, and it makes sense. It does correlate with congestion as well. So that's been done. In terms of the cirrhotics, what was the specific question again?
It was just, what about cirrhotic patients? I'm sure the technical difficulties in scanning, portal vein perhaps. I'm not sure if they were asking about things like portal vein thrombosis.
Yeah, I mean, I can't say I've seen that many portal vein thromboses in cirrhotics to alter my VExUS exam. Most of the time, the cirrhotics tend to be on the empty side, except for the cardiac cirrhotics, who definitely benefit from the decongestion. Yeah, I'm not sure what else I would add to that. Maybe Katie or Abhilash.
Yeah, I mean, I don't think we have a lot of data in cirrhotics, right? So I think I have certainly used VExUS in those patients, but I think there's still unanswered questions about the effect of, in the patient with significant ascites, how is that affecting their waveforms if they have increased intra-abdominal pressure? So as I'm going to use it, but it's only a piece of information. And as Felipe said, most of those patients are so vasodilated that they are emptier and they just have a ton of extravascular fluid. So yeah, I don't have a great succinct answer to that.
That's true. That's what is my impression also. In most of the hepatorenal consults, the heart tends to be like super hyperdynamic with a high cardiac output, and VExUS is almost always like grade 0 or 1. And having a baseline helps, because most of the cirrhotic patients who are admitted to the hospital, especially for awaiting transplant or in the ICU setting, they tend to have some baseline right upper quadrant ultrasounds. So comparing your portal vein waveform from then to the current portal vein might give some insight, because in general we expect that the portal vein is pulsatile at baseline, but in some patients it can just be like continuous at baseline despite increasing RAP. So having that baseline helps. And I try to rely on renal also as much as possible. And mostly I see continuous waveforms in these hepatic patients. But if there is ascites, my first recommendation is to drain the ascites and see if that helps kidney function. And then the rest of the thing comes next.